Good evening viewers, I am Dr. Amit Bhargava, I am Director Medical Oncology in Nayati Healthcare, and today I take the opportunity in front of you to talk about breast cancer. As we all know that breast cancer, or rather I would say whole of the cancer, is rising rapidly in our country, and primarily if I talk of breast cancer, which is a lifestyle related disease, the incidence definitely is rising. Initially when we talked about cancers in women, cervical cancer used to top the list, but of late if we see breast cancer stands number one in women. And basic reason for this is our lifestyle. Today I would talk about screening of breast cancer and basically how to do screen, how to screen yourself for breast cancer, what is the best age to start with for screening, and what all modalities we have for screening. First of all, to all the women, I say being a woman is definitely a risk factor for breast cancer, and as you age, the risk and the incidence of breast cancer increases. So the best thing to do is to get into a habit of self-breast examination, which is one of the easiest and the cheapest tool which you can do. Now, what is self-breast examination? Self-breast examination is basically nothing but examination of your own breast with your palm. Now, if you go to Google, you can type self-breast examination and you'll have so many methods and protocols which are available. You can choose any one of them, and I would request all the women to start practicing self-breast examination as early as possible. Normally, our criteria is that in India, since the incidence of breast cancer is much lower as compared to the Western world, so we start screening at the age of 35-40. But if you have an index case in the family, suppose you have your mother's sister, or your sister with breast cancer, and whatever age they had developed breast cancer, so start screening at least 10 years before the index case in your family. So how to do breast examination, that I'm sure you can get through Google. You have to use your palm of your hand and feel any kind of a lump in the breast, and the extent of your breast is below your collarbone till the place where your ribs end, and from your chest bone, that is the sternum, till your mid axilla, that is your armpit. So you have to examine each and every part of the breast with the palm of your hand. And how does a cancerous lump feel? For that, what you can do is just take a peanut, place it under the quilt, try to feel it from top, and you'll feel a hardish lump. So that kind of a feeling you will get. Please do not confuse it with soft lumps, because softer lumps are fibroadenomas, which are very common in younger women and in some elderly age groups. So if you have a hard, stony hard lump which is growing with time, that is one of the signs where you need to consult a specialist. The other modalities that we use for screening for breast cancer is mammography, ultrasound, and even MRI at places I would recommend where cost is not an issue, where we can use them to detect smaller lumps if you have a highly suspicious clinical examination of the breast. Now, what are the signs and symptoms of breast cancer? The commonest sign is a feeling of a lump in the breast in any of the quadrants or below the nipple, which feels like a very hard lump. At times it may be diffuse, at times it may be well circumscribed or marginated, and it usually is painless. If you have a painful lump, I would say 90% of them could be either galactoseals or a breast abscess, but a painless lump which is growing in time and not causing any problem to you is definitely a sign of malignancy which needs to be investigated. So you cannot leave such lumps alone. The other is, women think that dimples are the signs of beauty, but if you have dimpling of the skin in the breast, that is a sign for danger. You need to investigate. That could be a small tumor which might be growing under your breast. The other is we do not have normal discharges from the nipple, and especially if you have a bloody or blackish discharge from the nipple, and especially without any reason, then that could be a sign of cancer which needs to be investigated. The other is all of you must have eaten oranges in life. So if you feel that the skin of your breast is turning like an orange, what we call as a purely orange appearance, so that is again a sign of I would say advanced malignancy, where your lymphatics are also getting blocked, so that needs to be taken care of. At times you may not feel any lump in the breast, your breast may feel absolutely normal, but your armpit may show some lymph nodes or some I would say lumps in your armpit can happen before the lump in the breast comes. So even that needs to be investigated. That can be a sign of breast cancer. Many a times what we have seen that breast cancer doesn't present with the lump in the breast, but invariably it presents with some kind of metastatic disease, like it may come up with a bone pain, or it may have some deposits in the liver or lungs, but that's a rare entity. But if that is there, then that's an advanced stage for breast cancer. So these are some of the signs, and how do we screen for breast cancer. For a young girl, if you have any doubt, I would definitely suggest indulging into self-breast examination, and if that is not satisfying, then an ultrasound would be a good modality to make out. Nowadays on ultrasound, what we do is we do what we call as elastography. Elastography gives us a fairly good amount of an idea, where we can make a idea whether it is going towards malignancy or a benign lump. In the earlier times we used to use thermograms. Now in rural areas or in areas where all these facilities are not available, we have made use of thermograms, where we can have a broad idea, and it's a very cheap device which can screen masses in a day. So that is one of the modalities we are using at our hospital to screen the masses. So that's all about breast cancer, and in my next episode we'll talk about the treatment part. Thank you very much.